some training at my home country, Turkey, with Dr. Ture and Professor Shailan, and returned back to medicine in 2019. So very briefly, I will summarize each of those titles and our program and its reflection on our total outreach program. So in last 5 years, we hosted over 90 fellows from all over the world, and just 33 countries in 83 of them was low and middle income countries, and each average stay of each fellows was 5.5 months during last 4 or 5 years. And those are the countries that they came to here and spent time in our lab to learn our skills and improve their skills. So what we provide them, first we start basic training, microvascular training, and we come up different models during the COVID time because we were not able to do any on-site training. That's why we came up with different models that you can even perform at your home with basic setups, and we came up with the different assessment tools that you can use by your own and assess your results very briefly. And then the second thing that we provide in our lab is hands-on cadaveric training. So we start providing the specimens and the training cadavers in our lab, but during the COVID time it was not the issue, and also we have to cancel our hands-on courses. That was a big problem that time, and by the time we start to get hybrid the courses, we start doing just online first, and also for the second year in 2022 we combine and perform those courses in a hybrid way. And each fellow in our lab on average use 2.8 specimens, and 83 of them had enough cadaver experience. And we have our annual courses here, and during that time we had 20 courses in our lab, and also have 3 additional activities held in our lab space. We registered our lab in a core directory, and people reach out to us to use our space from Department of Orthopedics and also from ENT colleagues, they also used. And those are the courses that we provide. We have 6 annual courses, and including 1 medical students neurosurgery exposure course, and we already done with 2 of these year's course. And during that time, our fellows also contribute to our publications and get experience with publishing and research. So 63 of them contribute at least 1 publication. Sorry, 35 of them contribute at least 1 publications, and that also depends of the time that that's spent in our lab, and by more time they were able to contribute in more publications. And during the COVID time, since we cannot hold in-person lectures, we start a webinar series. Dr. Bashka started microsurgery resurgent series, and we invite 10 colleagues, esteemed pioneers in the field, to present their work in our platform and reach out to lots of people. And we also, Dr. Bashka also gave lots of online lectures during that COVID period and the following years. And I also was able to give some online lectures and in-person lectures in the countries that I visited. So here at UW-Madison, we have beautiful opportunities to train the people who can come to our place. But since the biggest part of the problem is that the people who cannot travel to here and get training here. So we're starting about and using our experience, the COVID time, how we can reach out those people and train them in their home countries, how we can use our AV setup to do live stream training. So that's something that we learned from the COVID period, and also like applied for our like first like hands-on courses. We start doing them online in 2021, and in 2022 we start doing them hybrid way. So, and we came up with the idea that we can provide basic training instruments in those countries and support them with online, live stream, offline, or in-person assistance, then make them those kind of like training available in those countries. So we start with donating the kits. As you can see here, this is Charbel from Lebanon. So he was the first guy that get our training set up, and he went back to Beirut, Lebanon, and give us like couple residents to train. We did couple live stream training sessions, and we also shared our offline videos, training videos that enable them to perform microosmosis practice in their home country, home institution. Also, as a like third step, I was able to travel in some countries and like give hands-on training in person. So this is the basics that we came out during the like. I just started to look for what we need for microvascular training just before the COVID time, and doing one like almost like 1 year lockdown. I came up the idea that what we need and start to purchase those kind of like stereo microscope instruments, light source, and was able to train like try all of them to come up with a basic, most affordable training kit. And I was like I had previous experience in those kind of training, and it doesn't mean a lot that I can do such training with those kind of stereo microscopes or plus microscope. That's why like after the COVID whenever we got more fellows and we start to train those fellows with those kind of kits, that shows that any like their value and their usage for the microvascular training. And all of our fellows still using the same microscope that we tried. So yeah, like after first experience with the microscope, so those are the microscope that we got from UW Swap, Surplus auction, or some other like state auction places, online resources. So I bid online, and if I won, I go there and pick them up, bring the lab, clean them, and test them, and then give them to our fellows to use and test also. So those are the, like some microscope, like I got more and more by time, since we realized their value. And those are the microscope that once like they were using in the laboratory on live animal surgeries, even like they were advertising to use in clinical practice. So this is a picture from like live surgery on a patient, and they just uncovered for the photography, and they said like it's you can use it proctology, gynecology, neurosurgery, and cosmetic surgery. You might not be able to do a like skull-based surgery with those kind of microscope because of the like length, working distance, or some other aspects, but you can perform like superficial surgeries, even those kind of microscope. As you can see here, this is the same microscope, totally the same, nothing different. The only difference is the stand. If you can put on a different stand, which we also tried that, and you can use those kind of microscopes in real surgeries. So whatever we need from such microscope, like they provide it, like they have like stereoscopic vision, they have magnification, and you can use different, like even right now, better external light source to perform such surgeries. So we had the kits available, and we started donating those kits using our fellows coming here. So we teach them here with those setups, and give them those setups to take them back to their own countries and train more people over there. And we also like a partnership with lots of different like NGOs to take our kids in those countries. This is Jean Rene from Medicine International Partners. So he took like those suitcases full of like instruments and training kits to Chad. I also traveled, like I joined those meetings in San Francisco, Los Angeles, in Cape Town, and wherever I go, beforehand, I talk with the people, connect with the people, and I said, okay, I can bring them down to the Congress, give your persons, and you can take them to like the Kenya or other countries. it was okay to find like cheaper, affordable like the kits, but the transportation is the biggest issue. So it must cost like 10 times more than like what we paid for the microscope. So that was like the way that we did it, and we connect with other colleagues from Duke University, from other places to take those our kits in those places. So those are just like few kits that we donate. So like this is the basic kits that we call just stereo microscope, light source, and tweezer sets. And also the tweezer sets that we came up with the idea from, like inspired from the pioneers. So that's one of our contribution to the field. So far, nobody realized that we can use tweezer sets, or like the pioneers, they start using the jewelry forceps, and one of the pioneers, Julius Jacobson, he defined the basic test how he can assess like the jewelry forceps, is it good for microsurgery or not. Inspiring from that basic test, I come up with the idea that we can use like any kind of like the tweezer set. I search on it and purchase a couple different like tweezers and try it, and it's perfect. I tried, lots of other people tried, and right now it's just like $10 set, and it has like 8 forceps that we can use for microvascular practice. In some place we were able to send the bipolar and even the drill, electrical drill, and in some place bigger microscope. Those are like Zeiss operating microscope, mostly called like dental microscope, and those are like surgical instruments, basic like cranial set. I can say like I pick each of them, so they are like used one but in a really good condition, high quality instruments that we send out in those places. So those are like our approach: donation, offline live stream training, and in-person training. So that was our like setup in our lab that we came up with during the COVID time. We have microscope that we connect to the computer, tabletop microscope, external cameras to show whatever we are doing here online. And that was like the first training that we have done. Sharbel got the kids here, went back to like Beirut, Lebanon, and gave me the 2 residents to train. And we connect on Zoom, and then I gave the training, live stream training, and they perform the training by themselves after our initial training online. So those are the things that we used. We did the demonstration, panels, drain, suturing, silicone tube, and chicken wings, and we also record those sessions. So right now, like we are using those recordings to share with the people, and those are the sessions and like details about those online live stream sessions. And also like since we record those videos, it's like extensive recording, like I can say like 10-hour recording of like training. And we start like spreading those videos online with the people, like we cannot perform like live stream training. And also like share the details of our self-assessment tools that enable them to perform, like watch our videos and perform them by themselves. So the third thing is hands-on training. So I was going back to my home country, and I already donated a couple microscopes there, and I get like 5-6 microscopes together with me, and I was planning to visit each center and or like give some basic like lectures and training in those places. And it turned out a big like slingshot program that we called right now. We did 1 day, 2 day, and 3 day program, and basically just initiate the training and teach them how they can move forward after we left. So the way that we do, they don't have to travel in like even outside of their institution. So we go there with all of our stuff and like everything included. We don't charge any money, and we just initiate the program, left a couple of our microscope in that institution when we left, and then also share our like offline video records, and then enable them to move forward by themselves. So this is this 2 day schedule. In 1 day schedule, we just use like 6 sutures and panels drain. On 2 days schedule, we use like 9 or 10 sutures with silicone tube. And in 3 days program, we include the chicken wings vessels in just 2 places. So far we performed like 15 hands-on training sessions in those like 6 countries, and train over like 270 participants for free in their home institutions, and left at least by now like it's over 90 microscope in those centers to enable them to move forward. So this is our ultimate like slingshot program, which gonna be held in Boston, Mass General Brigham, in just 1 week. So this is the ultimate offer that we can offer. So free participation, 1 day intensive training, and whoever gonna like attend that course, like we already like perform like online survey. We collected like the applications, and then we have to choose the applications, because in just very few places I have the like unfortunate like people that like were not that much interest. So we should able to like choose the like participants, and also donate the microscope just after the course, whoever participate in that course. And those are like participants that like send the application, fill out the application form, and we have already like the people from like 15 different countries. So we're gonna choose which one that we're gonna accept, and in just 1 week we're gonna perform that course. And wherever I went for those courses or the meetings, all other places, I start to like mention that what we are doing here, to just give them an impulse that they can do something in their home countries. And in most of the places I saw, they have the opportunity, they have the microscope, they have everything, but they don't know what to do. So I'm gonna just show you one really good example. Also, like I present lots of posters in like national, local or international meetings about our program. And this is one really good example. In 2023, I was in Little Rock, Arkansas for a course, and in just like 5-10 minutes time period, I was able to present our work there. And just after my talk, one neurosurgery resident from Mexico, he came to me and he said, okay, we established a lab in Guadalajara, but we don't know what to do. Like, let's do something together. In just like couple months, we were able to organize a course in their home institution, and it was one of the best lab that I saw. So like they had like Pantero in their lab, and they had like 10 Zeiss microscope available for like cadaveric dissection. It was beautiful, and it was beautiful course that we have done there. So this is another example. I was able to attend like the WFNS Congress in Cape Town, and this is my colleague from Chad, Yannick, and he knows most of the like the neurosurgery in the continent. So I told him that let's sit on a table during the lunch break and discuss about what we can do for those other people that we couldn't reach out. And those like senior neurosurgeons, they were like a organization for the CANS meeting in Brazzaville, Kinshasa, for the next year, and they invite me to that congress and organize a like course there. So we went there, thanks to those people that like they from Medicine International partners and CPC. So they helped me to gather those microscopes from all over the United States, and also Jaran, he traveled with me, helped me to organize those courses in Kinshasa. And like the microscope that we use in that congress, I purchased them almost like a year ago from San Diego, but I was not able to like bring them over. I reached out some people to keep me those microscope in safe there, and Dave from Medicine International Partner, he was able to drive there and pick them up, bring them here. So they helped me a lot, and those are like the microscope that we donate. Also, at the same time, we had lots of more surgical instruments that we took there. I think we had like 14 suitcases full of instruments and microscope. We went there, we organized 3-day courses, 3 one-day courses there, and also donate those 45 microscope to colleagues from all over the countries, like continents, 19 countries, 26 centers. We sent out those microscope. They reach out to places, and people start using those instruments and the microscope to train their like med students, neurosurgeons, and residents there. So this is one of the earliest like the outcome that we had. This is one of the things that keep us in the road, because if you cannot see the clinical reflection of what you are doing, it's sometimes like you get frustrated. But the people that train here in our lab, for example, Yannick, he was here in 2019 summer, and he was a Fiennes fellow. He did training here. He went back to his home country and started performing AV fistula cases for renal insufficiency patients for hemodialysis. And because there were no like general surgeon to perform it, and other people, they start to they cover the other surgeons like complications for nerve transfer. And two people, one from India, Dr. Jayun, he did his first bypass cases after our initial training here. And another colleague from Georgia, he did 1 month training here, just on 1 month, complete our training, went back to home, and I was able to visit their place, give a hands-on course there. And after the course, he moved on. He did practice with the chickens and placenta, and then they were able to perform first myomy case in adult patients in the country after all those training. So what is next? So luckily, we had one neurosurgeon from Turkey. He spent 1 year here, and he was planning to open a training room in his place, and we helped him to establish that lab, and we gave Dr. Bashka's name on that place. And also whatever what else we are doing is we are start learning to operate a microscope, that like surplus microscope. Even like Yeshagil, they start with using those microscope in 60s, 70s, and they are still in use. You can use those microscope because the optic quality didn't change a lot. Most the mobility change or all other stuff, but the optic quality, it's Zeiss quality, and it's still very valuable. I purchased those microscopes, and I put a camera on it, observer tube, and then disassemble it and send them over with Jean Rene to chat. And he started Yannick started to use for those AV fistula cases. In just a couple of weeks, he's gonna be here back in Madison, Yannick, and he's gonna present his work in our skull-based course. And this is a picture from his OR that he sent me from a surgery. Another very similar case, I had a colleague from Guinea, Dr. Demzi introduced me to him, and he didn't have anything. First, we sent him the drills and the bipolar coagulation. And the second time, he was able to come to United States, and I gave him an operating microscope, which I purchased for just $68, and I put on a camera and all other stuff, and change the light source, and hopefully he is going to use it soon. And this is another beautiful example. So this is the microscope part that I got from ophthalmoscope, ophthalmic microscope. So I put on a monitor arm stand, which more than what we need. And right now that's a total operating microscope. You can use it in perfect nerve surgery or basic microvascular anastomosis. And this is another thing that we did here. I got another microscope, very similar microscope available in our lab. Even right now, we have one more that even printed Dr. Bashko on it, probably he used in 90s, still in use. So we started to train the people here in our lab with those microscopes. First, they perform the microvascular anastomosis practice with the stereo microscope, then with that microscope, and then we gave them a cadaver and to simulate the real surgeries, and he performed those surgeries, and we record them in our lab with the cadaver using that microscope. And whenever he is going back to home country Nigeria, we gave them that microscope. And by the time we start publishing that what we are doing, and this is the first paper that we publish, it summarizes everything that we have done until 2023. And we publish another paper about our remote teaching, live stream training. And lastly, we publish another paper about the COVID time and our innovation to deal with the restriction, all other stuff. I would like to thank you, my mentors, and that people that I inspired, Dr. Damzi, Dr. Bashka, Dr. Turan, Professor Shagil, also special thanks to my wife for her country's support. If you have any questions, I would like to hear. Thank you. Yeah. Okay.
This is spectacular work, and the credit goes totally to you for this inventiveness and drive. This is the idea of finding a solution, and there's so much energy, so much bright people in the world who, given the opportunity, will make us proud. Thank you. Questions?
Thank you all. Requires a little effort on us, but reinforce past was mandatory for residents, but now we cannot use mandatory words for the with the recent data. They used to do these practices, and I used to score that up. Abdullah came up with new self-scoring. But it was very common, like a 10 practice, I had to score and 40 bags, and most people like Andy Bauer, Ralph Patel, Brandon Rock. Also, 14 residents, 12 perform, except 2. Every year, then it was managed. Since it's voluntary, out of 15 residents, you have to go to that. This is like that. You're back.
So far, we chose 40 countries with 150 donations, and right now, like people like reading our like papers from Harvard plastic surgery, and they also the global surgery initiative that they are reaching out to make any collaboration. So we just shared it like contact in those countries. In Africa, we have over like 90 microscope, and if they have the colleagues in those countries, they can connect each other and get the use of those microscope. And like we just like start whoever applied for our next slingshot program, a couple of them were not able to travel to the United States, but I reached out them and I said, okay, like you cannot come here, you don't have to come here because we already have like those microscopes in your country, and those are the names. Just contact with them and get your training in your home country, even in your cities. So those are the level that we are right now. So we are just connecting people in their own countries to get it done, those kind of training in their own countries. Thank you.
Thank you. Thank you.